Good afternoon, everyone, and thank you for joining us today for our second virtual town hall regarding community-supported sheltering and how Memphis Animal Services is going to do more for pets in our community moving forward. We appreciate all of you who took some time to read our materials in advance that we distributed. We're going to briefly go through some of that today as well, and then we're going to dig into the questions that you all have submitted about the plan, so we can make sure that our community is in alignment and that we're all on board with what the future of animal welfare looks like here in Memphis. I am pleased to be joined by my very special guest, also AKA my boss, Chief Doug McGowan, who is our Chief Operating Officer for the City of Memphis. There he is. And Chief McGowan has been looped in throughout this entire process about the ideas that we're looking at, the data that supports it, the national organizations that are guiding us. And so I asked him to join us today so he can provide perspective from the City of Memphis and how this fits into sort of our overall approach of being data-driven, making decisions based on best practices, and doing what's right even in the face of adversity. So Chief McGowan, thank you for joining us today. Before we start rolling through, did you have any words for the group to share?
Hey, can I interrupt? I'm so sorry. I'm hearing from a couple people that they can't hear. So before Chief McGowan starts talking, I wanted to see if we could address that. So
let's check.
Okay, I'm hearing that people can hear now.
You can hear. Okay, do you want me to circle back again? I'm sorry.
Yeah, you're just doing a little introduction, welcoming everybody, and then introduce Chief McGowan.
Thank you, moderator Katie. Keeps us in check. Sorry about that, folks. But just as a quick summary of what I said, we're grateful for you joining us here today. We're going to be going through some of the core tenets of this idea of community-supported sheltering, and then answering some of the questions that you all have submitted to us in advance. I am joined today by Chief Doug McGowan, who is the Chief Operating Officer for the City of Memphis and also my boss. And Chief McGowan has agreed to be here today to help us go through how some of these ideas that are very data-driven about progressive movements, utilizing best practices, how these fit into the overall schematic of city government. So Chief McGowan, if you have any introductory comments to share with the group, and then we'll move on to some of the key details.
Thank you, Alexis, and thanks everybody who's joined today, and thanks for your continuing support and interest in animal and human welfare here in the city of Memphis. I do appreciate the great work that has gone into continuing to look for solutions to problems that are long entrenched in our community. Thanks to the many people who have been involved and are on board, I know we have made a significant progress in our shelter. From going several years ago where we didn't have such good outcomes to now where we're having much better outcomes. We have a community of people who are supporting the work that we are doing. But I do think that we should never rest on our laurels, and we ought to look up. And one of those, I know we'll talk about this, but this community supported sheltering. I think ways to get to the cause of the problem. Example that runs it. There's an individual that has a pet that is continually running loose. Pick him up 3 or 4 times and bring him back into the shelter and then hope that we get him back to the owner. Or I can address the root problem that that individual is having, and that is he has a faulty fence. And perhaps instead of spending all of our time and energy corralling that particular dog, perhaps we should find a program that helps get that fence fixed. Now, I realize that is a very basic example of what we're talking about here. And there's many other topics that we'll talk about, but that's kind of getting to the root cause of the problem. And I will say that this is very parallel to the work we're doing in our emergency medical service core, where we are trying to match people with their best resource. We had previously, like many communities, had what I'll call a quote, you call, we haul mentality. In other words, if you called 911, we sent an ambulance and we took you to the emergency room. It didn't matter if you had a toothache, a mental health issue, or just looking for a ride, we still took you to the hospital. We were running out of ambulances. Now we have a whole new healthcare navigator program. We have a radar program where we send a paramedic and a doctor or a nurse practitioner And they on the spot analyze what the needs are and take care of those needs instead of hauling that person to the emergency room where they're taking up a bed, where they're taking up a precious ambulance. And so the models are very similar. The parallels are important because we are actually trying to match, in that case, people with the best resource. In this case, we're trying to match families and their pets with the best resource for the best possible outcome for both humans and animals alike. So with that, Alexis, I'll let you move into the presentation, and I'll be available for questions as well.
Thank you, sir. Appreciate that very much. And I think that is such a great parallel that you really brought to light for me. And Chief McGowan has actually matched me with somebody from the fire department where we've done some data sharing analysis of how we can build strong research questions and make sure that at all times we're evaluating our data through this process to make sure we're not missing any key components to success and that we're always measuring everything we do, which is something that is a core tenet of this administration. So I appreciate that perspective, sir. Katie, if you go ahead and advance the slide for us, let's move on to the specifics of this data-driven strategy. So what we're talking about today is the idea of taking traditional animal control functions and combining that with community-supported sheltering. And I think that's a critical point to make here. This is not about replacing, it is about enhancing. And it is about enhancing the traditional work we did of the dog catcher by adding more layers into our response mode, by filtering out animals that don't need to come to the shelter through proactive resource provision, which we know is going to help prevent those animals from needing to come into our shelter in an effective and safe way, but it's also hopefully going to prevent future animals that may be in that community from coming in, and we'll talk about that a little bit more. So you can advance that slide for me, Katie. So it is an animal shelter model that supports the human-animal bond by emphasizing keeping pets with their families. So this is pet parents helping to keep their pet, but it's also pet finders being supported. And let's make this point clear. People have found pets and gotten them back to their owners or rehomed without the aid of shelters and rescue groups for years, for as long as time has existed. That's always happened. This is about creating a better infrastructure around that program. It's about providing support and resources around that so that these people who do that already feel the support of our government and what we can offer. And the key here is that data is telling us, every study is telling us, keeping a pet in its community where it was found 10 or 5-fold increases the chances that that pet's going to get back home. And I think that there is some data that is coming out now nationally that we're hoping to replicate here locally that really drives home this idea that there are not as many stray, and by stray I mean homeless pets out there in our community as we think. A lot of data that's coming out really suggests that these pets all really do have homes. In fact, a study done in San Antonio recently that they went out and did an actual in-community study, they were able to extrapolate out based on their research that 87 to 96% of free roaming dogs at any given time actually had a home to go back to, which to me is a staggering statistic, 87 to 96%. So we're hoping to replicate that here, and we're looking at all kinds of data sets. But I think the key here is that if this animal is friendly to humans, which most of what we see come in here is, if this animal appears not to be emaciated, is in decent health, there's a strong chance that that animal had a caretaker of some sort. And so we need to focus our energy and efforts on connecting with the person who allowed that pet to wander freely in the first place and fix whatever issue is causing that lack of legal compliance, rather than spinning our wheels chasing a dog down. We're going to be more effective by working harder to identify who that owner is. And a tool to do that is keeping those pets in the communities where they are found with a found foster. You can advance, Katie. Like I just said, helps keep pets out of the shelter unless they absolutely need to be here. This should be the emergency room. Chief McGowan has said it since I think the very first advisory board meeting I saw him attend when Mayor Strickland took office. We are the professionals, and we should reserve this space for animals that need professional intervention, which not every animal does. We should be the place where the animals that are in medically urgent need to come because we have on-site staff veterinarians. We should be the place where animals that pose a public safety risk come because we have the trained staff and the tools to handle that. But putting an animal into a shelter that could just as easily have its needs met in a home environment is an overutilization of resources. And that's what we're trying to do, better balance what resource an animal needs with what resource we're providing, because that will create a more efficient, effective solution. We'll be more responsible with our taxpayer dollars, and it'll mean more live outcomes instead of animals dying for space at the shelter. Next slide, please, Katie. So what does this program include? A lot of it includes conversation, which we don't have a bullet point there, but I should say very clearly, a lot of this is about talking to people and working with people. And oftentimes that's the biggest barrier to these kind of programs. You know, if you're not incentivized, if you don't feel that pressure of euthanasia, you maybe say, well, it's easier to just impound the animal. But by us putting the priority on those community-based conversations, which may be a little bit harder, we're actually seeing better outcomes. And I have a great example of that to share shortly. But the services we're providing, this is what we've really been building up, is this arsenal of support services to solve the problems that we found as being the key reasons why animals were coming into the shelter. So we evaluated the data, whether on the owner surrender side or the stray intake side, what is causing this animal to need to come here, and what can we do to stop that? So spay neuter, we've started doing once a month spay neuter days at Spay Memphis that we are paying for 100%, 30 large breed adult dogs paid for by a generous donor. We take over one Monday a month, and we're getting those animals fixed at no cost to the owner. Dog houses, do you need better housing? Fence repair, does your dog keep getting out because he digs under the fence? Well, let us fix it for you. That's a far less expensive solution than impounding an animal. Behavior and training, veterinary care. We know that if we can provide a low-cost medical solution at an off-site vet clinic to keep a pet with its parent, that's a better solution than taking the pet in here, providing the medical care in our facility, and then trying to find that pet a new home. Pet deposits, we get a grant to help people pay their pet deposits because we know housing is a major barrier to keeping pets. Do you need assistance for temporary boarding? Assistance for caring for that found pet, finding the owner, rehoming the pet. All of these are services that kind of fall under this umbrella of what we're calling our Pet Resource Center. Next slide, please, Katie. So, frequently asked questions. We shared some of these with you, and we picked out a couple of highlights. This one I think is the most impactful, and Chief McGowan, as the leader of the Shelby County Task Force for COVID response, I think that this is one I would ask you to speak to. I think it's really important that we distinguish that what we're talking about with community-supported sheltering in our Pet Resource Center is a tool in our toolbox that we have ramped up for COVID response. But COVID response is a separate entity altogether. This is a pandemic that is still raging. We followed guidance from National Animal Care and Control Association saying go to emergency intake mode. And I think it's so critically important for people to understand why we had to do that. So anyone who's been in this building on a busy Saturday knows what our shelter looked like. It was Black Friday at Walmart. There were wall-to-wall people lined up in our building. People would have died if we had kept doing that. We would have been a super spreader event if we had not adjusted our operating procedures accordingly. We had to shift to an appointment-based system. In addition to that, from a staff perspective, we had to split our teams into 2 teams. And I'll give you a concrete example of why we had to do that. We've had 2 positive cases in our vet clinic. In both of those instances, had we had the schedule that we had before COVID, both of our staff veterinarians would have been exposed and been out for 2 weeks at a time. So by us doing that workforce continuity protection and having split teams, we have kept us in operation the whole time for those cases that had nowhere else to go, those true emergency cases. But what we could not do was continue operating at the same level. When you're doing an appointment-based adoption system, if you've got 30 to 40 dogs coming in every day, and you can only get 10 to 15 appointments safely in the building, the math doesn't work. You're upside down. So COVID response has been about saving human lives. It has been about complying with the mayor's directives. It has been about workforce continuity. It has been about all of the things that needed to happen in every industry around us for COVID. And we can't wait to be done with that, just like everybody can, but it's not over. Community-supported sheltering is a tool we are using to navigate this crisis, and then we hope to continue using to reduce our population just enough to never have to go back to euthanizing for space again. but it does not mean we're in emergency intake mode forever. Chief, if you could talk on that we are still in this pandemic response, I would greatly appreciate it.
Certainly, and I think you stated it very well, Alexis. Many people are obviously being impacted daily by the effects of this pandemic, and we are all in this together. I think there are several buckets of changes that need to be made. There's certainly those strategic level where we're limiting gatherings, we're limiting attendance, we're limiting capacities. There are organizational level changes that every business is actually making, and that's what Alexis is talking about. You have to adjust your operations to protect your employees and to still try to get the mission done. And then there are personal changes that people have to make in their own behavior, choosing whether to go to a meeting, choosing whether to go to a gathering, wearing your mask, making sure that you're doing social distancing, getting tested. So from a strategic level, we're handling those things. I've asked Alexis to look at this from an organizational level and the things that she needs to do to make sure that she can keep the facility open. Quite frankly, if she had not made the changes that we had talked about, we were at risk of not having a facility to send anybody to because we would have been closed down for COVID. So I think you said it incredibly well. COVID will not be with us forever. I think that the additive nature of the new services that we are putting into place are really that next level. It is clear that we got to a point where we were at a 90% save rate using the model that we had before. But there were still times when we were very, very close to being at capacity. Now, adding some new tools to make sure that we never go back to where we were is going to be important. So there will come a day, and I look forward to being there, when I am in the lobby with many individuals who are joyously picking out a new animal to become a part of their home. And getting veterinary services that they need, and or finding an animal that there was no other option for and ended up in the shelter. So those days will return, I'm optimistic, but so too am I about the impact of community sheltering programs that will provide even more value and more benefit in the long term for us. So I hope that you all will bear with us. We don't like the fact that we can't have families and kids in the facility on weekends to go find that new family pet. But we will get back there soon. I hope in the spring. Obviously, our numbers are going the wrong way right now. We are community spread of the virus. So we'll all have to stay firm in our commitment to those policies and practices for the time being. But we will get back to where we were. So thank you, Alexis, for giving me the chance to talk about that.
Absolutely. Next slide, please, Katie. So this is in direct response to the COVID versus community supported sheltering. This is a question. Is MAS not picking up strays anymore? That's incorrect. First of all, our response has never changed from the moment that this pandemic hit when it came to any animal call that comes in about an animal that is behaving aggressively. Those calls are prioritized, and in fact, we're getting there faster than we used to. We are really laser focused on those situations, as well as situations where an animal needs medical intervention, getting to animals that have been hit by a car or, have some other sort of medical issue that needs immediate intervention. We're getting there as quickly as we ever have. What we've been doing is for the other pets that are healthy, friendly, that don't have those sort of urgent professional needs, is we're engaging the citizens more. So let's say someone calls in a call about there's a stray dog walking down the street. We have worked with the 545 COPS dispatchers, which all our calls go through since February 1st. We've worked with those dispatchers to ask the question, do you know where this dog lives? Which was not a question that was being asked before. And it is amazing. I sit and go through those calls every single day and watch as they come in and evaluate them. The number of people who know exactly where that dog lives. It's remarkable. And we're getting that information from the citizen now, just by asking that one other question. So what does that allow us to do? It allows us to make contact with that citizen, even if when we get there, the dog's no longer running loose. We make contact with that citizen. Hey, we got reports your dog was out. And we're addressing the problem on the front end instead of going, patrolling, never locating the dog, and then saying, well, I guess we'll be back here tomorrow when they let them do it again. we're also asking the citizen, is there a certain time of day you see them? You know, and these are people who are calling who don't have physical possession of the dog. They're calling to report it. So we're using them as our eyes and ears on the ground because they're there. And even by the time we drive our vehicle to where that pet is, it may be gone. So we're engaging more with the community by using communication skills. Again, it's harder, it's more work, but it's helping us get to a solution faster, and that oftentimes doesn't result in shelter surrender. So again, idea, emergency room for those who need it, but then a community resource hub, not the first stop for every animal in the city. But I will tell you that when we get multiple calls about the same animal, somebody calls and says it's back out again, we go pick it up. Certainly if there's any kind of a pack, if there's a group of dogs together, we're prioritizing that because of the behavior that can result from dogs being in a pack. But I just think it's so interesting. Here's my favorite story that I was going to tell. I was talking to one of our amazing officers today, just before this call, and I told her that we were getting on this town hall today. And we were talking about this plan, and she said, Alexis, I can tell you within the past month, at least 5 times that I can think of off the top of my head, I went and picked up a stray dog. And before all of this, I would have put it on my truck and driven it back to the shelter. And then we would have crossed our fingers and hoped that maybe somebody would come get it. Well, you know what she did instead in those 5 cases that she can remember? She went and knocked around on doors. Said, do you recognize this dog? Does anybody recognize this dog? And 5 times that she can think of, someone opened the door and said, yeah, that's my dog. Yeah, that's my dog. So we literally were able to get this dog directly back into its home by doing a little extra communication and legwork on the community front. So yeah, I mean, our stray intake has gone down because those 5 dogs didn't come to the shelter. We still engaged with them. We did more work. We walked around, we talked to the neighbors, and we got the dog home. So our numbers look like we took in 5 less dogs, but those 5 dogs had a better outcome because we did it the right way instead of the way we've always done it. So next slide. So I think that this is an important thing. And unfortunately, and Chief McGowan, this is something I've heard a lot, is people always say, well, Memphis is not Austin, or Memphis is not this place. I think the one thing I learn when I go to these national animal welfare conferences is that all the things we think make us different are what make us unique, but all the problems we face are pretty similar. And that is the reason why over 30 municipal shelters nationally are piloting this model through a program called the HAAS program, which is Human Animal Support Services. They're tier 1 and tier 2 shelters. We're not one of the tiered shelters, but we're in working groups helping to learn about it and put plans together. But I mean, if you look at this list of national industry leaders, I mean, these are all the top people in the animal welfare industry. And I'll tell you, I have never seen this kind of alignment in terms of an operating plan. And they're all in support of the same methodology because the data and the science support it. Next, please, Katie. Okay, so that was all we wanted to run through in terms of just some of the highlights of the FAQs. Again, when you went in to sign up for this town hall today, there were even more FAQs there, a lot of other questions that were posed ahead of time. You're welcome to review those, but we would like to go through some of the questions that attendees on today's town hall submitted. So several of them are sort of similar in nature. So I might, depending on how time runs, kind of, weed through them. So Katie, if you want to go ahead and get started with reading those questions, and then we'll just see how we're doing on time, okay?
Okay, we do have 13 questions, and like you said, a couple of them overlap a little. Can you hear me okay?
Yes, we can.
All right. If the finder of an uninjured stray pet cannot keep the pet and cannot try to find the pet's owner, what are their options? Are they really supposed to turn a blind eye as the pet is left susceptible to injury, illness, and death? After a time, the community will cease reporting strays when they know their only option is to take responsibility for the pet or wait until it becomes injured, sick, or dies, then call MAS or Dead Animal Pickup. This is not just fear-based thinking, this is reality-based thinking, since the Humane Society has already had many citizens bring us strays feeling like they have no other option since MAS turned them away.
Okay. So, I mean, I would say that one of the great things about this program is that we have seen the community really step up and say yes when they're asked. And I think that too often in the past, we didn't ask. We had this sort of mindset of, well, it's our job, it's our responsibility, and we just sort of accepted the pet without having, again, that communication and that conversation, without offering alternatives. And since we've been asking the finders of pets to engage, the overwhelming majority say yes. And, I think all of us in animal welfare know that we have to rely on humans at some point in the workflow, or else we can't, we're going to be stuck. I mean, we can't get all the animals that are in our shelter out of this building unless we have doctors, unless we have rescue groups, unless we have fosters. So we're always engaging the community. I mean, we need volunteers, we need staff, we need all of these people to be a part of it. And all we're doing is sort of changing the workflow and saying, would you be a part of this now instead of after we bring it in the shelter and have it sit for 3 days in a kennel? Certainly, if there's extenuating circumstances and the person can't keep the pet, then we do accept it. But again, it's the idea of we've got to, and again, I'm talking about the community supported sheltering portion of this. COVID response was different. But long term, the goal is, can we try to filter this out? I had someone give me a great analogy the other day, like gravel. Not that I'm very familiar with gravel, but if you sift gravel down to have the bigger chunks and then the middle chunks and then the finer chunks, what ends up in the bucket at the bottom is going to be a lot less than if you just dumped everything and all the same. So what can we filter out by offering a myriad of resources? But again, the idea here is if we can divert, we should try. And that should hopefully create enough of a cushion for us to not get back into what we were pre-COVID. And, Chief McGowan, I probably try not to put too much fear in you all the time, but when you said we were near capacity, I would say that we lived over capacity all the time. I would say that, especially from like a human ability to emotionally handle it, from a capacity to care, yeah, we had a kennel we could put somebody in, but we were beyond what was reasonable for us to handle. And so if we can push that down by asking the community on the front end, will you be a part of this? And then accepting those that the people just aren't, we do have people who find pets that live in an apartment building where they can't have pets. Well, what are they supposed to do? But what we can do is we can accept that pet and ask them to help market that pet and spread it on their social media. So it's about engaging people as early in the process as possible, because this is a community issue. It's not a shelter issue. And we'll never, ever fix this by ourselves.
Alexis, let me just ask, if you go back, I think part of the question there is that people believe that there's no other option and that they have to wait for the animal to get sick and die. That's just not the case. That's what you said there. If there is no other option, then we're going to continue to do the work that we do. We're just asking if we can explore a few other options before we get there. And based on the data, we see that exploring those options yields success in many, many instances. So instead of just assuming that we won't be successful, we're going to assume that we will be successful, and that if there are no other options, then that's why we're here. So I would ask that everybody help share that information.
Yeah, it takes us out of the role of first option and puts us in the role of last resort. And Chief McGowan, I thought this was interesting. I was on one of these national calls last week, and a very wise woman, her name's Dr. Ellen Jefferson, and she started Austin Pets Alive, which is really, kind of a gold standard for an organization that came into a community and partnered with a municipal shelter to save lives. And they pull like all their behavior cases, and they've really taken this leadership role nationally with their organization, American Pets Alive. And Dr. Jefferson said this the other day on a call. She said, this is our fault. We taught the community for years and years, find a dog, bring it to the shelter. Don't want your dog anymore, bring it to the shelter. Don't like this cat hanging around, call the shelter. So we built this system where the community became so entrenched in the idea that we were the solution to every problem that now we're sort of trying to undo our own bad messaging. And so I think that's why there's some confusion about this, absolutely, and then throw COVID in the mix. But the idea really being that we as a community can solve these problems far more effectively than leaving it to just the shelter alone to achieve. Katie?
All right. Yep, next question. Recently, while on duty and driving an MAS vehicle, an MAS officer brought a stray pet to the Humane Society. The officer could not take it to MAS and did not want to leave the pet on the streets for fear that it would be injured or killed. As you know, the Humane Society is a limited admission nonprofit facility, so we will not be able to accept all the stray animals that would have once entered MAS. Can we at the Humane Society expect more MAS officers to bring us uninjured stray animals, and what should we tell them if we can't accommodate their request?
I would not say that that's a reasonable expectation because that does not fall under our acceptable protocols or policies. And I would just ask, I am not aware that that was reported to us, but I would certainly ask if something like that happens in the future. I'm available via email. Please do let me know because I want to make sure that we don't have gaps in our service provision like that. That does not fit into our current protocols.
Right. We frequently have pet finders bring pets to the Humane Society reporting that they tried to call MAS, but there was no answer. Is there a good phone number we can provide for these finders to ensure that they can reach someone with their stray animal concerns? Is there a chance that this is a problem that could be falsely lowering the data, i.e. the stray animal calls you're using to monitor the success of the community program?
Sure. So certainly when we're open for business hours, 636-1416 is our main number. If someone has found a pet that they need assistance with, they can call our Pet Resource Center directly, which is 636-1418. All of that information is listed, very easy to access at memphisanimalservices.com, and we guide you through those steps. But I would not anticipate that any delay from our customer care team, helping customers in person and not being able to get to a phone call. That would not have any correlation between our calls for service because, as I mentioned earlier, as of February 1st of this year, unbeknownst that a pandemic was approaching, but I'm so glad it worked out this way, we switched to having all calls for field service dispatched through 545 cops. And this was critically important to me and was something we had worked on for quite some time because when you called here, if our dispatcher was on the phone with someone else, you might get a voicemail. And so that could delay our response to a critically important call. So now if you call 545 cops, you can reach someone live 24 hours a day, 7 days a week for a call about an animal out in the community. And our officers are actually equipped with phones that have the mobile dispatch software on their phone. They've been trained on it and they've been using it since February. So they're directly connected to that system. They get radio calls of priorities that are holding. And so we've actually really closed that gap and increased our customer service in that regard. By switching to that. So I would not anticipate that challenges getting through to our office here would have any correlation to the calls for animal control services in our community. But I will say, just as one side note, I too get frustrated by when we are not able to answer all of our calls here. Some of that has certainly been due to reduced staffing due to COVID. But I am excited the city has invested in a new phone system that is being installed in December that is going to allow us a lot more oversight tools so we know how long people sit on hold. These are data points I don't have access to now with our outdated software system. So I'm looking forward to being able to raise the bar on our customer service for telephone calls very soon, thanks to that investment by the city.
Okay. As one of the local veterinarians who frequently treats and sometimes euthanizes injured strays in the community, I'm concerned that this program will result in more stray animal injuries and deaths. Although so far your data does not suggest this, are you also including reports from other rescue groups? Perhaps other rescue groups need a way to be able to provide MAS with the number of stray phone calls, sick and injured pets that they receive on a monthly basis so you can add those numbers to your data.
Sure. So one good thing that exists that has been a big thing in animal welfare is the Shelter Animals Count data portal. And so because we have formed a Shelby County Animal Welfare Coalition, we're able to go in and review the data for all brick and mortar shelters in our community to monitor whether these other shelters have had an increased intake in any way. And so far it appears that there has not been an increase year over year for other brick and mortars. So that's good news. In terms of rescue groups, I think one of the challenges with that is we would certainly welcome the data if they selected to share it. But even some of our partners, our pet placement partners, when we've asked them to share data in the past with us, have indicated to us that they're volunteer run, they have day jobs. And so putting another layer of responsibility for data tracking on them is not something that we would want to sort of mandate. But I can tell you that I've personally reached out to our rescue partners on multiple occasions to share these thoughts with them. We've got some great feedback from some of our rescue partners I got one the other day. It was just a great message. It said, "Sure sounds like it's worth a try to me." Because, you know, I think that there was a recognition that the revolving door, you know, they're always having to help in Memphis because there's always this revolving door where there's still more pets in need at the shelter. And I've actually talked to some rescue groups who, shockingly enough, because I know that there's some sort of social media anecdotal expression that there's more stray pets out there. Some of the rescue groups I've talked to have said that they've actually struggled to find dogs that they can place up for adoption, and that they've been going out of the Memphis area because they haven't been able to find enough that need homes here. And perhaps it's because we haven't taken animals out of their neighborhood when they were about to walk back home and brought them here. You know, this study that was done in Austin, which I would encourage people to take a look at, this Austin reunification study, they were able to come up with the fact that dogs found there, almost all of them were found within 1,000 feet of their home. It was pretty wild. So I think that there is I think that there is a lot of opportunity for us to ask more questions of rescue groups, and I'm definitely going to do that. So I appreciate that question because I do want to get a better sense. But so far, we haven't really received a lot of feedback from them in that regard. Okay, Katie, you got one more in this section of questions, or no, two more. Okay, go ahead.
Two more. All right. In theory, the community sheltering program sounds like a wonderful idea, but should be implemented slowly, responsibly, and humanely. Suddenly seizing the pickup of all seemingly healthy strays in a city with high stray numbers, in addition to leaving a large number of animals susceptible to injury, illness, death, and ability to reproduce, will place a burden on the community and the lesser funded rescue groups. I've seen this firsthand at the Humane Society. Since financial assistance is being offered to citizens, will MAS also provide funding for rescue groups who are providing shelter for strays?
Yes, so one of the things that we've been talking to our rescue partners about, because they don't have an in-house veterinarian to provide those services, is offering where if they take a pet directly from a citizen, that they could bring the pet in here and get it vaccinated and spayed and neutered. We haven't been able to implement that yet because, again, with COVID response and us only having one veterinarian on site at a time, that has created a real bottleneck for services. Our vet clinic is as busy as ever performing services. But that is something that long-term we absolutely want to do. So we want to do that. And I see a question in the chat box just about some of that data that I mentioned before. It says the Humane Society has had a 29% increase in stray animal intake during this time. The vast majority of these were reported to have been turned away from MAS. Well, I will say when I reviewed the shelter animals count data, I did not go into intake type. So that is very possible that the percentage of pets that came in were higher from stray versus owner surrender. I simply looked at overall intake by species, and it appeared to be in alignment with 2019. But it is very possible. I did not break it down by stray versus owner surrender. So that I'm sure that data is correct. I was just looking at overall number of animals coming in the building, like overall intake. So. All right, one last question in this, and then we'll move on to the other set of submitted questions, Katie.
Yep. Does MAS have parameters in place to help them decide when the strategy is not working? If so, can you share those parameters? For example, how many phone calls reporting strays need to be received? How many healthy strays become injured and sick? How many dead animals be found and reported?
Sure. So our parameters are the data. You know, we have looked at data, and our calls for stray pickup are down and have been. Stray aggressives, dead animal pickup calls are down, which we think is an important metric to look at. Bite call data is down. And so we'll continue to monitor those metrics all along, and we will adjust if the data stops supporting this model. But as long as the data continues to support the model, I think that we would not be very logical to not continue in that way. I see that there's another comment that owner surrender for the Humane Society is up 134%. Well, I'll tell you that what I looked at was April to September data year over year compared with 2019. So I don't know if there was a data error on shelter animals count then, but it appeared that there were fewer animals brought in from April to September this year at the Humane Society versus April to September of last year. So that's the data set I went off of. So, you know, I don't know if maybe there was a typo in shelter animals count then, but that was what I used for that reference point. Okay, next set of questions.
All right. Citizen calls MAS about stray dogs in their area. The citizen refuses to take in or foster the dogs. They insist that they cannot and will not foster the dog and insist that MAS send animal control to pick up the dog. Will MAS animal control pick up the dog and take it to shelter?
I think we probably kind of touched on that previously. It's sort of the same type of question, but again, we're going to do more on the front end to try to address the problem at its root cause. We are going to try to engage that citizen, but if those efforts fail, then we will resort to our traditional impounding philosophy. Again, long term, this is separate from COVID.
Right. Citizen agrees to foster a stray dog. They have no idea about temperament, personality, etc. They have no training or experience handling dogs they take in. What happens if the found foster dog turns aggressive and or bites someone in the foster home? What happens if the dog causes damage to their property? Is MAS assuming liability for all that?
Well, I would certainly say the good thing is that has not been an experience that we have seen. And in most of these cases, when someone is a found foster, this is a person who has stopped their vehicle or been walking down the street and they have taken possession of this animal. So they've already had some sort of positive interaction with this animal. You know, if it's an aggressive animal, people are calling our officers immediately. So this is not a situation where we've seen that demonstrated on the front end. We haven't seen that happen. But should that situation occur, we would immediately tell them, like, we'll send an officer to come get the dog, or you can bring it to us, whatever you feel most comfortable with. But, you know, our found foster program does have some clauses in it about, you know, liability, or like, let's say the dog chews up, you know, the carpet or something at the house. But that's just not something that we've seen. We just haven't seen it. You know, people, when someone stops to pick up a dog, you know, there's a relationship that happens there, and we're not finding that turns. That's just not been our experience.
All right. What happens if the foster dog escapes? Did MAS microchip the dog? If not, and someone else finds them who cannot or refuse to take them in, will MAS send animal control to pick up the dog?
So I think the second part of that would be send animal control. The same process would begin just like it began before. Whether or not we would microchip it would depend on where it's at in its stray hold. So legally, I can't microchip that pet until it's, you know, had its 72-hour stray hold under law. So what we would most likely do is schedule that person who found the pet to come in for vaccines after the 72 hours have passed, or they could come in and get the vaccines before that and then bring it back for a microchip. But we are microchipping those pets. You know, if a pet gets lost, we would follow the same process as we would if an adopter's pet got lost, or a traditional foster pet got lost, or a rescue group lost a pet. You know, all these things happen, and unfortunately, they're a part of real life. You know, that sometimes a pet gets lost, but we just can't make policy around those kind of exceptions. We have to look at the vast majority of cases.
All right. Owner surrenders. If an owner refuses to take advantage of your resources to help keep the pets regardless of circumstance and insists that you take the pet, will MAS take in the pet?
Yeah, so the owner surrender prevention program is actually not something new for us. We've been doing that since 2017, and to great success. You know, we take in owner surrenders all the time. That is not something that has gone away, even though I think it's important to point out we have absolutely zero ordinance or legal mandate to do so. Our ordinances say nothing about taking in owned pets. That is not even part of our listed function. But it's something that historically has always happened. And so what we do instead is we work with these owners to great success, but will there be a certain percentage that the people have done all they can and have tried? Of course. And then we'll help them. And so we do take owner surrenders, but we're going to effort these other things first because it's the right thing to do. And in the vast majority of cases, if given the proper resources, the people don't even want to give up the pet, period. They just, you know, there was this old mindset in animal welfare where a rescue group, I've heard this talked about a lot, they'll say, okay, your dog got hurt and your dog needs surgery for its leg and you can't afford it. So here's what I'm going to do. I'm going to take that dog from you and I'm going to pay for it. And now I'm going to find it a new home and adopt it out again. Why? It already had a home. Why can't we do more to support that person who already had and loved that dog, but simply was not financially able to afford whatever that expensive surgical procedure was or that expensive medical treatment? So this idea that we cannot bring a pet back to its pre-existing owner by simply providing them some core resources is foolish. I mean, Chief McGowan, you said it before, like if the person needs some help with dog food, let's give them some dog food. Isn't that a better solution than ripping these families apart? And I think that there's this flawed perception in the world that wealth equals quality when it comes to pet ownership, and that a low income person can't possibly be as good of a pet owner as a wealthy person. And we're trying to break that stereotype and that stigma by connecting lower income pet owners with these resources so that they can have the joy of pet ownership like everyone else does, so that they can provide the quality of care that their pet deserves and keep that pet in a loving home, in a home that that pet already knows and wants to stay in.
All right. How can MAS state that it's cheaper for the city to pay a citizen to take a dog to a veterinarian instead of MAS taking in the animal? What if the foster is or are significantly injured at the foster home property? Why will MAS need any veterinarians if they will have much lower intake, thus less need for spay neuter and for medical treatment and vaccinations?
Well, I mean, I think as we can see right now, I mean, we have hundreds of animals in our care, and those animals that are in foster care still need veterinary care. And we have almost, I think, 250 animals out in foster care right now, and those animals still need veterinarians to care for them. We still have over 150 animals in our building, some of which, were injured, hit by a car, or have medical needs that our veterinarians need to provide for. There's still spay and neuter that we're doing every day. We would love to, again, start offering more spay and neuter for our rescue groups for pets that don't even come in through here. We would love to do more community cat spay and neuter. But our clinic is wall-to-wall busy with treatments for animals, medications, vaccines, heartworm tests, spay and neuter, x-rays, all the things that go into providing complete medical care for the animals that are here, as well as all of, a bunch of what's in foster are like baby kittens. And I promise you our veterinarians would tell you that sometimes baby kittens are the most difficult because they constantly have diarrhea or eye issues. And so there's a lot of work that goes into that. So we need veterinarians. And if the need to care for animals in our building or in foster suddenly diminishes, which I don't see that happening, then what a great resource to have these dedicated, skilled veterinarians who are very good at high volume, high quality spay and neuter available to serve the community at large. So I don't think it would ever be an issue of them not having enough work to do. It just may be a shifting of the work. And then the other part of that question was, how can it be cheaper? Because our average cost of care per animal is $309 when you factor in the machine that is running this facility. We pay a good living wage here. The associations have negotiated very good pay rates for our staff. So it is expensive to run our operation and do what we do. And so if I can spend $100 to send a pet to an offsite vet clinic that provides treatment versus bringing it here and racking up that in-house, then it is a better financial resource. And we have some great veterinary partners in our community that have stepped up and said, we'll provide you these low-cost services because we want to be a part of the solution.
All right. MAS says that citizen calls reporting strays have gone down in the last several months. This is because citizens that call MAS have been told for months that MAS will not pick up non-aggressive, non-injured dogs and are told to let the dogs run loose. So, of course, the calls are going down because citizens have learned that calling MAS is useless. There are more strays in the streets. I see posts on social media daily from people who see and or have found stray dogs running loose, and they do not have the means or the willingness to house those dogs for an indefinite period of time. Using to pick up strays is causing the stray dog population to increase, which will cause dogs out of hunger and fear to form packs. These packs can become dangerous for the citizens of Memphis. If those strays attack or injure citizens, will MAS be liable or responsible for injuries and damage?
So a couple of points made there. I certainly understand how people feel. Social media is the best thing that ever happened to animal welfare and the worst. And I think that there's something called exposure bias that we all need to keep in mind, is that the more you click on and engage with a certain topic, the more those things are going to show up on your feed. And so while I certainly understand that it feels like that based on what you're seeing on social media, I as a government employee cannot make decisions based on social media. I have to use data. And I would venture to guess that knowing the fact that the vast majority of our community can barely tell the difference between Memphis Animal Services and the Humane Society, and they ask me often if I'm on Farm Road and vice versa, I think that the average citizen in Memphis has made a decision not to call because of some information that I think is more closely held within the animal welfare community. I just don't know that there's data that supports that. And you know, we don't tell people not to call us. In fact, when they call us, we provide assistance every day. And there's people right now that are grateful because we have sent traps out and we've caught dogs and things like that. So I think that it's hard to base stuff on social media, I guess is the point I'm trying to make. And in terms of packs, I did address that earlier. I agree. Packs of dogs are where problems exist, and that is why that is a high priority for us, and we address that as soon as we receive that call. And one more, Katie?
Yeah, one more. All right.
Thank you.
This new policy places a tremendous burden on the underfunded animal rescue organizations. Rescue organizations are currently trying to contend with the numerous additional strays already created by MAS not picking up strays, not injured, not aggressive. Does your new policy of taking in found strays instead of the strays going to MAS and covering all fostering costs also apply to assisting rescue groups?
So I mentioned this earlier that we are working on some long-term plans to provide more of that assistance to rescues. You know, we've already done a lot to try to help our rescue community. You know, one of the things I did was I got rid of pool fees. They used to have to pay actually quite a bit of money. Then I reduced that. I think they paid $50 an animal. Then I reduced it to 20, and we actually got rid of pool fees completely for these rescue groups while still providing medical care. So we've already kind of done things to try to support that. We'd like to do more, again, once COVID's over and we can have a fully functioning clinic that's not at half capacity. But I do think that one of the challenges with that question is I haven't heard that from the rescue groups. And so like when we send out these communications about these programs, I don't hear that back. I don't get that feedback, and I do send emails directly. And so I would encourage, if those of you on this call are connected with some rescue groups that are feeling that, to give me a call, because what I'd like to do is offer them some of our strategies and solutions that have worked for us to try to replicate those as well. I mean, this is the community supported sheltering solution does not have to be just the shelter. It can be a rescue group that's offering these same resources or connecting someone to our resources. So I think that there is a lot of work that can be done collectively and collaboratively, but we have to start by talking to each other. And so I think that that's kind of where that was the last question. I'll finish and I'll turn it over to Chief McGowan for some closing comments. But I think the biggest thing here is that animal welfare is cannibalistic, okay? People beat each other up all the time. I remember the day before I started here, I was a hero, and the next day I was the devil. And it was for no other reason than my place of employment changed. We have worked diligently for 4+ years now, implementing every progressive best practice policy that comes our way from every national animal welfare organization. We attend conferences, we send staff to apprenticeships and fellowships, all on scholarship, not using taxpayer dollars. We all learn and attend these things in our free time. And everything that we have done has been based on data and best practices from around the country. That's what this is too. There is nowhere you can look outside of Memphis in the animal welfare world where this isn't happening. And the key where it's most successful, the communities where it's most successful, is where the community is being a collaborative partner and where the rescue groups and the brick and mortar shelters, all animal welfare partners are working together and saying, what can I do to help you and what can you do to help me? And removing that pointing of fingers or the questioning or the doubting or the judging. Those are not things that save animal lives. What saves animal lives is raising your hand and say, what can I do to be a part of the big picture solution today? And how can we do it together to maximize our impact? So my hope is is that as people start to understand more about what we're trying to do and the services we're trying to add, that we can start to have a more collaborative approach to animal welfare in this community instead of that sort of territorialism that I think has too often run this world. I mean, I've seen rescue groups fight over a dog in our lobby. Like it was absolutely nonsensical. I was like, I have 150 more in the back. Please stop fighting over this one dog. We've got to get out of that mindset if we want to truly maximize our life-saving impact as a community. And I'll turn it over to you, Chief McGowan, for any closing thoughts before we wrap today. And I appreciate so much everyone being here.
Thank you, Alexis, and thank you everybody who's attended, and thank you for those good questions. I'm going to start my comments by playing Jeopardy. The answer is yes. The question is, will you pick up the dog? So we had that question 11 times today. The answer is yes, but only now after we look for every other option available to us before we have to pick up the dog. The answer is yes. The question is, will you pick up the dog? Only after we've explored every other option will allow us not to have to transport the dog to MAS. Now, MAS stands for Memphis Animal Services. Services includes sheltering, but it's not the only service. And it's not the only service that you're paying for. This is not about saving money for the city of Memphis. I have dramatically increased the budget for Memphis Animal Services, the staffing, so that we can provide a better outcome for animals. This isn't about saving money. Alexis says that we need more money and more staff to do our job better. That's what we're going to do. That's what we did for our Memphis Fire Department, and we will find a way. So this isn't about saving money. This is also not about me having a building that has staff but no animals. I would love a world where we didn't need to shelter animals at either a rescue or at any municipal facility. That is just not reality. This is about preservation of resources for the most critical need so that we don't ever end up again at a place where I am at complete full capacity and having just to euthanize otherwise healthy adoptable dogs. You all worked with us and there was a fair bit of skepticism. There was a lot of suggestions, and you all trusted us to come up with a better solution when we took this out from underneath the Parks Division, put it in an executive under my direct supervision with Alexis reporting through me to the mayor. And to the comments about slow implementation, there was no call for slow reform at Memphis Animal Services in 2016. In fact, there was a sense of urgency that was imbued by the community upon us and said that you guys have to make a change immediately and dramatically. And that's exactly what we did. We based it on data. We looked at things that were working, things that weren't working, and we have pivoted and adjusted all along the way. And we've continued to do that from 2016. We will do that with this program as well. I am here telling you I am accountable for outcomes. I'm accountable to the mayor. I am accountable to you as the citizenry for outcomes of every single operation in the city of Memphis, no less the operation of Memphis Animal Services. If anyone believes that there is a world in which we think a good outcome is to have packs of wild dogs roaming the streets, citizens taking in dogs that are going to attack them and their children, you are sorely mistaken. We are looking for good outcomes for animals and for human beings, and to preserve the shelter as the place of last resort so that we do not end up again having to be the people who are accountable for euthanizing otherwise healthy adoptable dogs. This is additive in nature, and I would ask that as you trusted us to reform Memphis Animal Services from the place that we were in 2016 when we came on, get to the point where we are now, I ask that you give us a little latitude and earn trust, because we have made significant reforms. There were many rescue agencies that would not partner with Memphis Animal Services, and probably for very good reasons in the past. I think we built a good coalition in the community, and I would ask that you not portend problems that don't yet exist. Certainly, we or the foster program, I can think about that. This is about efficiency. If there is an animal that is found, someone willing to foster, it doesn't change the accountability or the fostering policy that you would put in place for that person. All it does is shortcut having to pick up the animal, transport it back to the shelter, then go the process of trying to find a foster to transport it back to the home of the foster. It's about efficiency and preserving assets. And so, yes, this is new. Yes, I understand that there's going to be a fair bit of questions. But again, this isn't about saving money. This is about saving the lives of otherwise healthy, adoptable animals and preserving assets so that we can continue to do that in the future. Because unfortunately, there are always going to be pet owners who are not responsible. And so I don't see this problem going away anytime in the near future. Much like with my emergency medical services that I have in the fire department, trying to find people with mental health issues, elder orphans, people who just need a ride across town, who take away resources when you actually need an ambulance because you're having a heart attack and I don't have one. I'm trying to preserve that resource. And that doesn't mean I'm saving money. It means I'm actually spending more money to provide better service. So I hope that you found this helpful. I very much appreciate you looking at this with a jaundiced eye to make sure that we're not just trying to, get out of our accountability, because we are not. I am telling you, I am accountable for outcomes, and we are going to look at the data. And if the data says we need to do something different, then we will, just like we have done for the last 4 years. So, but it doesn't happen without good community partners. And the folks who have chosen to attend today care enough to invest their time to be partners in animal and human welfare in Memphis and Shelby County. And so this has been an hour of your time that you could have spent some other way. And so I appreciate you taking the time and having enough interest to invest in this particular topic. So I really, truly do thank all of you. We would not be here today if it wasn't for a community, and I realize it's a small community of people relative to all of the 1.5 million people in our MSA who truly care about this issue. There are lots of folks who just don't care. You all do, and we are better for it. So thank you so much. Thank you, Alexis and team, for putting this together. And I look forward to the next opportunity and for hearing feedback, and we will continue to monitor the data to see how it goes. Thank you.
Yeah, thank you for being here, Chief McGowan. Folks, this recording will be available. I believe we posted on our website. Is that correct, Katie? Tomorrow, we will get that posted. And again, certainly anyone can email me with any follow-up questions, alexis.pugh@memphistn.gov. We will be hosting a third and final virtual town hall on this topic on Thursday night at 6 p.m. featuring Chief Programs Officer Mark Peralta from Best Friends Animal Society. Their organization is leading the national movement to go no-kill by 2025 across the country. And so we're going to talk with him about how some of these practices fit into that overarching philosophy by Best Friends, and what Best Friends' position is on this and how they're supporting this effort. So thank you all for joining us today. Have a fantastic rest of your Tuesday. Goodbye.